Welcome back to the Morning Blend. Well, tennis elbow sounds like a problem that comes from using a racket too much, but many other things can cause it. Swimming, climbing, manual labor jobs or service jobs like waiting tables, even playing guitar or drums, and other daily living activities.
Yeah, Linda Klein is an occupational therapist with Hand Surgery Limited. She's here with more on how to treat this common problem and what it might be if you have it. Thanks for being here.
Thank you.
I think it's great. Let's talk about what tennis elbow is. We kind of explained a little bit about how you might get it or what activities may lead to it. What exactly is it?
Well, tennis elbow is actually a very painful condition of the outer part of the elbow that's caused by a tendon that actually begins right there on that outer bone of the elbow. And that tendon goes on to become the muscle that inserts at the wrist, actually. And so it's the wrist motion, or repetitive or hard wrist motion, that causes the strain at the elbow where that muscle actually originates from.
Is it inflamed? Is the tendon inflamed? Is that why the pain is usually radiates right here around the elbow?
Yes, it's either inflamed or a degenerative condition of the elbow that just, as we age, our tendons can't hold up to the same kind of force that we can tolerate as younger people. So,
well, we kind of answered the question, do you only get it from playing tennis? No, that's not really what it's from. It can be from all these different kinds of activities. So I can imagine you see all ages kind of feeling some of the pains of a tendinitis or tennis elbow.
yeah, certainly the great majority of people actually are between 30 and in their 30s to 50s that develop this. As we get older, our tendons again can't tolerate that same kind of stress. More middle-aged people, but definitely it can happen, especially younger, if you're doing something very, very repetitive, as you mentioned earlier, drumming.
Yeah.
Something that's happening just thousands and thousands of times throughout a
Performance,
thank you.
Working,
Yeah.
You brought this brace as an example. Is that kind of like a frontline defense, one of the first things that you try if people complain of these types of symptoms?
So this is just called a counterforce strap, and it goes right over the muscle. And what it does is apply some pressure over the muscle, so when the muscle acts to contract, it can't pull quite as hard from its origin at the elbow bone. So it's a counterforce brace. Puts pressure right over the muscle, and it can help to decrease symptoms a little bit during active use of the muscle. It isn't a cure-all for everyone, and but it does certainly help some people with controlling their symptoms. And I think that's the big key with tennis elbow, is trying to control the painful symptoms.
You know, I think oftentimes when people think of hand surgery, you know, the location that you're at, Hand Surgery Limited, we think of just the hand and the wrist, but this is really the whole upper extremity that you treat. And as an occupational therapist, is that the next line of defense? Molly said this, you know, that could be one of the first ones. Is occupational therapy really what can help alleviate the symptoms of tennis elbow?
Truly, only about 5% of people go on to have surgery with this condition, so the huge majority of people are helped either through therapy and possibly an injection by the doctor in that area. But I think that the biggest thing that therapy can help a person with tennis elbow is instructing them on the cause of the problem and the activities to avoid that can help to minimize the pain with their symptoms. And the biggest thing that we can try to teach people is to avoid lifting with their palm down. So you can envision that the weight of whatever the object is being supported completely by that muscle that inserts at that elbow. And so lifting with the palm down, for instance, a person's purse, or 12-pack of soda, or the grocery bags, all of that weight is being supported just by that one small muscle. And over time, that can really cause problems with that tendon origin there at the elbow.
So what do you recommend? You lifting palm up?
Yes, palm up or around larger objects, two hands together, you know, thumb side up, where you're using your larger elbow flexion muscles to support the weight of those objects.
You have some other activities that you should limit or avoid, one being just that repetitive wrist motion. Is it the turning or twisting?
Two things. The wrist coming up and the wrist turning palm up are the motions that the muscles that originate at that outer elbow control. So yes, repetitive wrist motion and palm up motion, or just sustained or forceful motions in that direction, even not as common as somebody's, let's say, who's
like
a drummer,
gripping,
but gripping, yes.
Gripping,
Every time we make a fist, our wrist is pulled up into an extended position, that muscle does that action. So sustained
it's also
or forceful gripping.
Gripping or that
and
twisting. Okay.
Yes.
What if that's your job, though? Is to, I mean, you know, like, what if you're a drummer
like
for a living?
Or a semi-truck driver. You're kind of shifting a lot.
Exactly. That is a really good question. And so for people like that, we really have to sit down with them as therapists and talk about what they do, and is there a different way to position their hand or their forearm so they're not doing it in the same manner. So activity modification. There are some people whose jobs do make it very difficult to control, but this is a condition that tends to kind of wear itself out over the course of a good number of months. And in the course of that, we really want to try to control a person's pain so they can stay as functional as they can.
Well, I think it's great to know that there's ways to help it so that you can continue doing the activities you love or the jobs that you depend on. It's important, but it's important to find ways to make it better by working with someone such as yourself. So we want to make sure everybody has the information for Hand Surgery Limited so they can call. If you're having any issues with your hand, your wrist, your elbow, your arm, it's always a good idea to see a surgeon there at Hand Surgery Limited to find out and pinpoint what that problem is. 414-453-7418 is the phone number, or handsurgeryltd.com is the website as well. Thanks so much.
Nice to have you on the show.
Yeah,
Thank you for your
thanks.
time.